Midazolam, commonly known as Versed, it is a benzodiazepine and a Schedule 4 drug. So the class is technically a benzodiazepine, but the FDA gives it the Schedule 4 rating. Mechanism of action, it interacts with the GABA receptors in the central nervous system, which then causes central nervous system depression. With that, you get sedation, anxiolysis, amnesia, hypnosis, all that good stuff. Prevents seizures as well, but it's all acting on those GABA receptors in the CNS. Pregnancy class for it is D. So indications, be seizures, chemical restraint, and procedural sedation, something where you got to knock them down. It's very effective with that. Contraindications would be central nervous system depression that you don't want to worsen or you're trying to correct for some reason. Depressed vital signs with Versed or Midazolam. It does cause respiratory depression, can cause some hypotension, bradycardia because it is a depressant. So if you have depressed vital signs already, it can worsen that. Adverse reactions, like I mentioned, CNS depression, can also cause some headaches, hypotension, nausea, vomiting. Those are all common ones with it as well. So it will potentiate other CNS depressants, something to keep in mind. Typical adult dosing, according to the book, is going to be 0.1 to 0.3 milligrams per kilogram, and then you can give it IV, IO, IM, IN, any of those, up to a max of 10 milligrams usually. You're going to follow your local protocols, of course. Most commonly, though, it's going to be like a straight 5 milligram dosage for adults, or straight 2.5 milligrams, and then it'll state your route that you're allowed to give it. And if you can repeat it every 10 or 15 minutes, something like that. For the kiddos, it is definitely weight-based, 0.1 to 0.3 milligrams per kilogram, and max of 10 milligrams. That's a very high amount, but it can go up to that. Duration, onset is 1 to 3 minutes. Peak effects just depends on the person, within just a few minutes usually though. And then the duration is 2 to 6 hours, so it does work for a relatively long amount of time. Something to keep in mind with the older patients that we might run, someone who is maybe having renal issues or liver problems, you do want to decrease your dosing. And then also, Versed is a very good medicine for sedation and also for seizure control, but because it does cause so much sedation, it is usually not our first choice for just anxiety. For me personally, if I've got someone who's anxious, I'm going to go with something like a small dosage of Ativan or something, lorazepam. And that usually works really well for anxiety. Versed is just it'll sedate them really hard, so I try to avoid it for something like anxiety. That's about it on this one.